So combination treatment is really, I think, necessary to achieve optimal restoration of the face and maintenance of the face as you go forward. We use biostimulator, the PLLA that we've talked about, Sculptra, and I use HAs in the areas that you're moving. So we think about Sculptra as support for the bone and support for the soft tissues. Areas where you have movement, like the lips, around the eyes, we really can't use Sculptra, so we use a hyaluronic acid. That would be Restylane or Juvederm or Juvederm. So we're going to pick once again off of our shelf the type of hyaluronic acid that best fits our needs. Restylane versus Juvederm family. They're made differently, have different consistencies. If we look at this case study, we can see a patient with aging. He's going to be in his 50 some years of age. You can see the volume loss in his cheeks, the hollowness under his eyes from previous surgeries done elsewhere, and you can see the overall facial shape. We have used Sculptra to maintain the volume of the face, and I've also used Restylane around the eyes and the soft tissue to correct the tear trough deformity. So the combination of Sculptra for support and hyaluronic acid for the lower eyelids creates a picture of a gentleman into his 60s that looks much younger than when he was in his 50s, done purely with Sculptra and Restylane support.